In 1979 rather, following the famous Alma Ata Declaration the previous year, the World Health Assembly adopted the Global Strategy for Health for All by the year 2000. Now, the main thrust of this 20-year strategy development was of health system infrastructure based mainly on primary health care for the delivery of healthcare services to the entire population in the respective member states. Now, fast-tracked to September 2000, a further 15-year strategy was adopted by the United Nations. This is the well-known Millennium Development Goals, or MDGs, signed in September 2000 by all 189 UN member states, including South Africa. Now, the agreement was to try and achieve these goals by the year 2015. Now, of note is that provision of comprehensive primary health care would directly address no less than 5 of the 8 MDGs and indirectly address all of them. Now, the 15-year MDG strategy ends in a few weeks' time. So September 2015 saw the 8 MDGs now transitioning into the 17 Sustainable Development Goals, or SDGs, to be completed by 2030. Yes, another 15-year strategy. Now, back home, over 20 years into its democracy, South Africa still has major challenges in healthcare. Perhaps the biggest health challenge ever has been HIV and related communicable diseases like TB. Whilst tackling the problem of these communicable diseases, the burden of non-communicable diseases has been mounting. So today we reflect on the state of healthcare in South Africa. Our expert panel will help us navigate through what the challenges are, what successes we've had, what solutions are, and most importantly, what the road ahead looks like. So sit back, relax, and learn from this exciting show ahead. You can be part of the show by calling us with your questions or views on Johannesburg 714-6843, 6847, 6857, or interact with us on our Facebook page, SABC Health Talk, and on Twitter at SABC Health Talk. I'm Dr. Sello Mutau, and this is Health Talk.
Our health system is facing a desperate situation. Private medical care is expensive, government hospitals are overcrowded, ambulances take a long time to arrive, medicines run out. We are weighed down by many diseases which are too expensive for our health system to treat. But most troubling is the unnecessary loss of life. These experiences are shared by millions of South Africans.
Mina into engiyibone esibhedlela nginokubona ukuthi sometimes kuba neline enkulu ma unomuntu ogulayo.
The problem is the clinics aren't open every day.
See, my problem is that to come to the health care, I've got to travel far, get up very early in the morning while it's still cold, and it's so inconvenient and time-consuming that we don't know how we can help ourselves.
I-queue yinde kakhulu ebhedlela zethu. Futhi ne-medications kwesinye isikhathi asibi nayo.
You must have imali yokuthi ufike la. And mawunganayo uzohlala njengalama pain lawa until you either die or you survive it.
It's here in hospitals that doctors traditionally treat patients, trying to cure disease after it's found. But the system can't cope, and change is needed urgently.
So why is change needed urgently? Why are healthcare reforms needed so urgently? What are the challenges? Well, let's get a deeper understanding of what the challenges are from our special guests. First up is Dr. Flavia Senkobuge. Dr. Flavia is Vice President of the African Federation of Public Health Association. Welcome to Health Talk, as always.
Thank you, Dr. Mtaon.
Right. And next we have Dr. Themba Moeti. Dr. Themba Moeti is CEO of Health Systems Trust. Welcome to Health Talk, Dr. Moeti.
Thank you, Dr.
Right. We're going to be joined on the line later on by Sasha Stevenson. Sasha is attorney with Section 27, and I believe we have her on the line. Welcome to Health Talk, Sasha.
Thank you, thank you.
All right, we'll hook up with you just a little later. But let's start up with you guys here. And we're saying that, I mean, in that clip that was shown, I mean, clearly there's problems in the country in healthcare. Let's try and understand what challenges we have. Let's start with you, Dr. Senkobu.
I think the first thing is an understanding of the broader challenges of the health system in South Africa, and we have what we call we have a kind of a three-pronged issues, and then so in terms of diseases we have what we call a quadruple burden of disease. So issues around non-communicable diseases, communicable diseases, diseases around poverty and violence and injuries. So this is quite peculiar in our health system, as most African countries usually have about a double burden of disease and some even a triple burden of disease. But over and above that, we do have other issues. So issues around implementation of policy.
Before that, let's just unpack this quadruple burden of disease. You're saying double burden. What actually makes up this quadruple burden?
The four that I talked about. So the quadruple burden of disease are really, if you talk about non-communicable diseases, these are things particularly in South Africa which are, for instance, hypertension, diabetes, issues of mental health. And then if we talk about communicable diseases, HIV and AIDS, TB, those are our big two major ones. And when we talk about issues around violence and injuries, we just now have been having had a conversation of 16 days of activism. Those are some of the things that come very, quite pressingly when it comes to issues around violence and injuries, car accidents, intimate partner violence, and so on. And of course, issues around poverty-related illnesses. And the issue around poverty-related illnesses are particularly pediatric illnesses which can be prevented, for instance immunization, and so those are that's the broader spectrum of the issues around the quadruple burden of disease.
All right. Dr. Boeti, surely this is not peculiar to South Africa, and you've done some work in the sub-Saharan African region, or the SADC region. What is the situation there like?
Okay. No, thank you. Well, yes, as you say, it really isn't peculiar to South Africa. I think if you look at the disease patterns in developing countries in our continent and in the subcontinent, yes, as Dr. Sinkubuke was saying, non-communicable diseases have been the main challenge. But I think most countries have large communicable disease problems, such as TB, HIV. In other parts of Africa, of course, with more tropical climates, diseases like malaria, I think is a very big problem. But I think at the same time, with economic growth, changing societal patterns, changing lifestyles and patterns, certainly non-communicable diseases are a growing problem in almost all these countries. And I think most people would agree that in the 21st century, in about 20, 30, 40 years' time, that will be the major challenge we face. But I think what is peculiar, I think, in our setting is that as an upper middle income economy with a history where, in fact, you've got very huge income disparities. And I think that is something that is going to take quite a long time to change. And the social determinants of health in our setting, I think, is really what is fueling our HIV and TB epidemic. But then also you've got huge problems with poverty. And these, I think, influence the kind of risks and the kind of challenges that people face, and even their vulnerability to these diseases.
Yeah, we're going to come back to the reasons and the risks. But let's just unpack communicable diseases a little and focus a little more on that. Because, look, we've been grappling with HIV and associated TB for a long time now. And what's your perspective on what we've achieved so far with HIV?
I think if you look at what we've achieved with HIV, I think there have been huge strides made in fighting this disease. I mean, Southern Africa is the epicenter of the epidemic, and South Africa has the largest population of people living with HIV in any single country. And I think the kind of strides that we've made have been tremendous. We are certainly seeing a decline in HIV incidence in the general population. Our prevalence levels have kind of leveled off at around 17% or so. And this really is a reflection of the fact that although we've got a very large number of people on treatment and have had, fairly high prevalence in the country, the reason it's stabilized at that level is because we've got a treatment program which allows many people who are infected to live with HIV. But then if you drill down a bit further, incidence rates are definitely falling. The number of new infections is reducing. But of course, it's still too high. I mean, it was estimated to be around 469,000 or so in 2012. So, but if you look at what the achievements really mean that the country has done, this is South Africa and a few other upper middle income countries in our sub-region is one of the few countries where about 90% of the health budget or 90% of the HIV/AIDS budget is met with domestic resources. We've seen in the past 10 years or so an increase in life expectancy. A good reflection really of our very successful HIV/AIDS program. So a huge problem, but one where we're making good progress.
Yeah,
but
we shouldn't paint a picture of this all gloriously good. We still have huge problems.
Absolutely.
In terms of especially vulnerable populations, the young girls between the ages of 15 and 25. But let me just invite comment from Sasha Stevenson on the line. Sasha, let's get your perspective on the state of healthcare and what you perceive as challenges currently.
Well, thank you. I agree with the previous two speakers. We've got a huge burden of disease. We've got some signs of improvement, but there are some issues that we could really tackle that would lead to huge improvement. So, for example, in our ARV program, we've got a huge ARV program that the incidence is dropping. Many more people are being treated, and yet we continue to experience medicine stockouts at our clinics and hospitals that mean that the program can be crippled. And so there are these few key interventions that we can make that can really make a huge difference to the health profile of the country and the health system of the country.
Just talk about the health system of the country. I mean, surely this two-tiered system that we have, obviously a clear differentiation between the private sector and the public sector. Surely that cannot be sustainable, do you think?
No, absolutely not. I mean, if we're looking at the numbers, we spend about 8.6% of GDP on health, but half of that is spent in the private sector that caters to around 15% of the population. So one of the key problems in our health system, as I see it, is the inequities. We have a huge amount of money being spent on a small number of people in very expensive healthcare services. And it's this exact problem that the competition market inquiry on the private health sector is going to try and tackle, and that the national health insurance system is supposed to start to address.
Yeah. Just hold your thought there, because we're going to come back and talk a lot deeper about at least, some of the reasons or risk factors that perpetuate these problems. So after the break, we try and understand why is it that we continuously are faced with these challenges with healthcare. Please stay with us.
On Trends, we take you down memory lane with Lionel Richie, who will be touring South Africa next year.
Just saying.
We pick up the best of movies to lead you to a joyous weekend full of action. South African Fashion Week was back with a bang, showing off new designs for 2016. Mikasa's Home Sweet Home album will keep you dancing this festive season. For more entertainment news, join your host Refulo Mula every Friday at 9 p.m.
Welcome back. So what are those factors that precipitate or perpetuate a poor state of healthcare in our country? Well, we find out from our guests. We still have Dr. Flavia Senkobuge and Dr. Themba Moeti, both public health specialists. Dr. Moeti, CEO of Health Systems Trust. Dr. Senkobuge, Vice President of the African Federation of Public Health Association. All right. Earlier on, we spoke about, obviously all the challenges that we have in our country. We spoke about the burden of disease, and we touched a little bit on the some of the structural problems. Now, let's look at those factors that perpetuate this status quo. Dr. Sengobuge?
I think that's actually not such an easy question
Yeah.
to
I always
answer.
ask the difficult
ones.
Yeah.
But I think that broadly speaking, there are a number of issues. And then I think the first one is about the policies that govern a particular country. So in our country, we've got wonderful policies, but the issue is around implementation. And that's a very key factor. And I think broadly speaking as well, something that also governs those policies is actually the state of the political climate at that point in time. If you look at case in point of Burundi at this point in time, that is a total collapse of a health system because of a political dispensation. And these are key issues that are there in an African region that need to be taken.
Lack of political will.
Lack of political will, political instability in a country. I think over and above that, it's not just about having a particular disease profile. On top of having good policies, you do need the health professionals. You do need the science, the technology, that will back up. So in cases of, for instance, we were just talking about HIV and AIDS. In as much as you are treating patients, you do need to invest in the research and development of newer drugs, newer testing kits, and that, and keep up to date with the newer advances that are happening in any disease profile, whether it's non-communicable diseases or anything. And the other thing is I think of key, I think I just touched on it, is the issue around infrastructure. You can have the best nurses, the best doctors, the best policies, but if you do not invest in infrastructure, health infrastructure, and its broader spectrum, whether it's the clinics themselves, you can have the best clinic, but if that clinic does not have facilities of testing, does not have facilities of treating patients.
That's a mouthful you've said, and we want to just break it down a bit, because we need to come back to facilities, we need to come back to personnel, but let's just focus a little more on the burden of disease, especially on the communicable disease side. We're seeing now resistance to TB coming through. We're seeing quite lots of cases now of MDR TB, XDR TB. What are the reasons behind all of these?
I think, as most people would know, TB is an eminently treatable and preventable disease. And I think one of the thing that really breeds drug-resistant TB is really weaknesses in your treatment program. If people are not adhering to treatment, then of course the likelihood of breeding resistant organisms is much higher. So that's where the problem starts. And then of course once it started like that, then you've got now the risks of spread of resistance organisms within your population. Now in settings like ours, at least about 90% of the adult population would have been exposed to TB bacteria at any one time. And in a context where HIV is a major challenge, any condition that reduces your immunity increases your risk to developing active TB if you've got latent TB infection. So most of us as adults in our setting would be walking around having been exposed to TB bacteria. So once you then develop diseases like HIV, then you've got a more than 10 times risk of developing active disease than a person who hasn't. We also have situations like our mining communities where gold mining and so forth, that significantly increases the risk of people developing TB in those settings. And then, of course, those risks are then passed to the peri-mining communities in which those people live. So for me, in my understanding, the real origins of drug-resistant TB are weaknesses in the TB program at a certain point in time. So what we need to do is make sure that we can diagnose the disease early, put people on effective treatment, and make sure that they are adherent to their treatment. And if you do that, you are able to largely prevent cases of drug-resistant TB. But once you have them, then you need to have effective ways in which you can have treatment, and it needs to be accessible.
Something important you mentioned there was, the migrant labor situation, where somebody, obviously travels with an infection, perhaps half-treated, and spreads it. Globalization, basically. We've seen the story around Ebola recently. To what extent is this a problem?
Absolutely, and I couldn't agree more with Dr. Moete, and I think this is what I was saying earlier on in terms of it's not just about the good policies, the human resources, and then it's what is happening in the disintegration of the health system. If we have issues like Ebola, that they will create a total disintegration of that particular health system. Then it becomes difficult to treat your communicable diseases. It's not business as usual anymore because you need to treat this particular disease that has or outbreak, as we would call it, and then you can come back to other. That's how we think of it. But in reality, you still need to continue with your TB program, your HIV and AIDS program, because once that outbreak has been removed, you must ensure that there is a sustainability of those particular services that are happening.
Let's invite again Sasha on the line. Sasha, we spoke a little earlier about facilities and I mean, there's always issues around the quality of care in our, I suppose, public health system. Your comments, please.
We see a very varying situation when it comes to the quality of health services across the country. So in some areas of the country, we see very good quality services. We see sufficient human resources. We see good facilities. In other places, it's a very different story. And one of the biggest problems is how provinces react to budget cuts in the light of their situation, their health quality situation. So, for example, in some provinces, we see when there's a budget cut, a decision to stop all hiring of new staff members. And this means that, and it's often in these cases where there are insufficient human resources in the first place. And so, as I say, we see this variation in the quality of healthcare services and then poor decisions getting taken on how to spend money when money does get tight.
Let's talk about personnel now. I mean, you touched on it a little bit, that we need to have, adequately trained healthcare workers. Do we have enough? Do we have adequately trained workers in this country?
So again, it depends on how you look at it. There's some writers who have argued that we do have adequate human resources in the country. It's exactly, it's about the distribution that we have and where they are and what they are doing. So in essence, in our country, we certainly need to take a step back and say, where are our health professionals and what are they doing, And so because of this two-tiered system, where we have the private and the public, most of our health professionals are in the private health sector, and then we do have some who are in the public health sector. But what are the colleagues who are in the public health sector are certainly very much overburdened, and they certainly are very much overworked. So in essence, I think if you take a broad slice, and if you force me into an answer, I would say no, we don't have enough health professionals. But I certainly think that we do certainly need to take a step back and also have a consideration about the issues of distribution.
But what's causing this inequitable distribution, Dr. Moete?
I think one of the main things that's causing the inequitable distribution is really the conditions of service and opportunities in the two sectors. I mean, we have a private sector which is well financed, and as our colleague mentioned, there's a disproportionate amount of funding goes to servicing that private sector with a relatively small proportion of patients. So in the end, people will then tend to move to the better resourced side of things. On the flip side, you've got a public health service that needs to deal with the bulk of the population. The resources per capita that it has are considerably less. And so then that affects the conditions of service, staff morale, and infrastructure is one of the major challenges. And often in developing country settings, and I think our setting is also one, we can develop and put up good infrastructure, but then there are issues around maintenance and so forth. All of that then has an impact on how you manage patients, an impact on staff morale. And so I think what the difference is really the efficiency and effectiveness of health systems. And that is where In our setting, I think there are the resources to provide the services. Resources, of course, will never be enough. There are always challenges. But I think our main issues are around quality. And those quality issues are really around, one, I think skills in our health service. I think there are areas where skills need to be improved.
Right.
Management skills, I think, are a major challenge where you now need to improve the efficiency and effectiveness. And it's, it's instances like, as you mentioned, Ebola and others. Those are the things that show the weaknesses of health systems. And so I think that's the real crux.
Let's just hold it there, because then I'd like us to focus on solutions. Okay. When we come back after the break, we now look at solutions, because the saying goes, for every problem out there, there must be some solution. Okay. So that after the break. Please stay with us.
2012, our government proposed a healthcare revolution, the introduction of the National Health Insurance Plan, or NHI. It's a plan to revamp our healthcare system over the next 14 years and to ensure that each and every South African has access to good healthcare.
What I want us to do, stick to the basics of healthcare, check maternal mortality, check infant mortality, check the load of HIV and AIDS, check the cleanliness of our hospitals, the drug stock outs, the infection control, etc. All of them need to be changed in the new system because we're not satisfied with them.
The backbone of the National Health Insurance Plan is primary health care.
In primary health care, you try to stop things from happening before they happen. In other words, you promote health and prevent diseases rather than just cure and payment. That's how we want to change the system.
In a well-functioning primary healthcare system, a hospital is a last resort. Clinics will play an essential role in catching diseases early and treating them. When people come to a clinic, they will get checked up for everything and are told how to stay healthy. The aim is to treat and manage illnesses before there's a need for complicated and expensive treatment at a hospital.
How many people have ever gone just to have their blood pressure checked and say, I want to know my blood pressure? Many of them only know when there is a stroke. How many of them have checked their blood sugar to know that they may be diabetic? Many of them know when they'll end up in hospital, either in a coma or with a serious complication. It's then that they are told you are actually diabetic. So primary health care means detecting those things and making people test for them before they start happening.
There are three main programs which will form the core of our primary healthcare re-engineering. The first are teams of community-based healthcare workers who will take healthcare straight to people's homes. They'll teach people about disease and find out if they have problems that need treatment.
House by house, who is in there? Is there a father? What are his ailments? Is he diabetic or hypertensive? How do you deal with that? Is there a mother? Is there a granny with arthritis? Is there a young girl who suffered teenage pregnancy? What do we do for her not to fall pregnant again? That's how they are going to work. And in other ways, there will be a mediator between communities and the healthcare system. Many people believe primary healthcare starts at clinics. At clinic is already late. It must start in the community and at home. And that's what primary healthcare workers will do.
Over the next few years, thousands of community healthcare workers across South Africa will be trained to do this job. They'll be able to reach all households in even the poorest of townships and will be able to help people in knowing about the state of their health before it's too late. The second part of primary healthcare re-engineering is a schools-based healthcare program where all children can get checkups and are taught about good health at school. There are 12 million school-going children in South Africa. Targeting them whilst they're young will ensure that they can grow up to be 12 million healthy adults and reduce the amount of disease our system has to fight in the future.
Close to 25% of school-going kids in the country are classified as obese or overweight. What will happen to those kids in the next 10 or 15 years? They'll be either diabetic or hypertensive. And how are we going to cope with that?
The third part of primary healthcare re-engineering are district health specialist teams. Each health district across South Africa will have its own team of specialists. They will dedicate their time to training and offering support to healthcare workers. Through these 3 programs, we will strengthen our primary healthcare and revolutionize our health system.
You don't have to go to school to be a scientist or a doctor or a health worker to know that prevention is better than cure. I think that has been taught over the ages, and I don't know why we made it disappear from the mindset of people. I want to bring that mindset out into the minds of our people. For every South African, prevention is better than cure.
There have been huge efforts into improving hospitals throughout the country. This includes ensuring that people who run our hospitals are the best and most qualified for the job, and making sure that they are properly trained. Also, our health department has created an Office of Health Standards Compliance. This office will send inspectors to health facilities to ensure that they are meeting certain standards for 6 key areas: cleanliness, infection control, attitude of staff, safety and security, waiting time, and drug stockouts. Over the next 14 years, there will be many exciting developments in our health system, with the aim of ensuring a healthier South Africa.
We should get excited because we'll know about our health, whereas at the present moment, we'll all know when there's disaster. Just knowing about those beforehand and knowing how to protect yourself.
All right. Now, a well-functioning healthcare system requires robust financing mechanism, a well-trained and adequately paid workforce, as you heard, reliable information on which to base decisions and policies, and well-maintained facilities and logistics to deliver quality medicines and technologies. Now, this is not my statement. This is according to the World Health Organization. So, how can we get ours to be a well-functioning healthcare system? Let's get enlightened on that by our guest. We still have Dr. Flavia Senkubuge, Public Health Specialist, Vice President, African Federation of Public Health Association, Dr. Themba Mweti, CEO of Health Systems Trust. We've seen that long clip, an example of solutions, possible solutions. And I'd like us to focus now on solutions, having outlined all the problems. Let's start off with financing. We mentioned healthcare financing. We'll get back to primary healthcare engineering, but let's start off with healthcare financing. We've seen the release of the long-awaited white paper on the NHI. Your view on whether or not this is adequate to meet our challenges?
I think I want to start off and say that this is a very welcome piece of legislation in our country, or piece of reform, because it really meets the articulation of the global dialogue on universal health coverage. And as such, I think that it's a step in the right direction, because as our colleague said previously, it really is about the issues of access. And for me, the bottom line of national health insurance, or funding healthcare as such, is to ensure access for populations. And we've seen that there are many countries which have done very well. For instance, if you look at the case of Rwanda with the Mondiale de Sante, it has done very well. It has contributed to the as I call them, the numbers, the numbers in terms of the disease profile and all the issues issues. And so it has contributed to this wellness, as the minister was saying in the insert, a wellness habit or a wellness mindset of the population only because they have access. And so I think that the national health insurance is definitely a step in the right direction.
All right. Perhaps before I get to you, Dr. Mwiti, let's welcome Sasha Stevenson in our Cape Town studios. And thank you for being with us, Sasha. Perhaps a subject close to your heart? Let me get your view in terms of the NHI. Dr. Senkobuga mentioned now the issue of access. Your views, please.
I think what we've seen so far is that we have serious problems with inequity in the health system, as I've mentioned before.
Yeah.
And the National Health Insurance Program is really a way of trying to improve those problems. And so it's a way of ensuring better population coverage. It's a way of ensuring that everybody who accesses healthcare accesses the same level of healthcare. And in terms of universal health coverage, and also in terms of things like economic development, this is a really, really important intervention that we are finally seeing the beginnings of.
All right, Dr. Mwiti, we mentioned earlier, let's come back and, we're talking solutions now. Okay, we mentioned the issue of facilities. I mean, in that clip we showed, there's an effort obviously to try and improve some of the hospitals, new hospitals are being built. What more can be done to, address the issue of facilities?
I think, as you say, talking solutions, the good thing about, the development of NHI, I think we are looking at really holistically what kind of resources are required to drive and enable us to get the kind of health system that we need.
Yeah.
Now, if you look at health facilities, I think the important thing is when people have access, you need to make sure that when they come to the health facility, they need to have a clear expectation of what they will find. And they need to have a clear expectation of the kind of standard of care that they will receive. So I think there have been two good developments in terms of solutions in the country that we're moving forward with. One is the Ideal Clinic initiative,
right,
which is really working to see to it that every primary healthcare facility is one that offers a certain standard of care, that it has a certain level of expertise and human resources available, and that patients will know that I don't need to go and look for this good clinic. Every clinic that I go to should be able to offer a certain standard. And I think it's been a systematic process where government is trying to make sure that at the end of the day, all these clinics meet those standards.
Right.
Now, it's one thing for the department responsible for health to address the issue of quality improvement. But the other good development, which was mentioned in the clip earlier, is the development of the Office of Health Standards Compliance.
Right.
Because you need then another agency which is going to ensure that those standards that have been put forward are actually being met with. And it will be difficult for the entity that is providing service to then be able to then also certify that it's doing those things. And I think the other thing is that this initiative, in some of the work that we've been involved with, is also motivating health staff to actually see that indeed we can make our facilities better, we can make this a more positive experience for our patients, and I think that has knock-on effects. So I think the key things going forward in solutions are, one, to have the right policy environment, and I think in the country we are fortunate in that respect. And then having that right policy environment, then you need to move forward with implementation. And I think the kind of analysis that you get going into, the very good policies and strategies that we put forward and the NHI itself, is that you then have to you're then looking at the kind of data, evidence-driven solutions, and I think that is, so we're moving in the right direction.
Yeah.
You need to be ambitious. There are huge challenges. And everybody knows that financing even of NHI itself in terms of getting to the goals that we'd like to see is going to be a challenge. But you have to start, and I think the phased approach that's being looked at is the appropriate one. And I think reflecting on the kind of inequities that are in place, you do need a system that addresses that and gets that kind of redress, because you need everyone's health to improve for the country's productivity. There are many, many spin-offs. So for me, I think we're starting in the right direction, but there's a lot of work to be done.
There's still a lot to be done, yeah. Dr. Senkubuge, I mean, primary health care is not only about provision of healthcare facilities. I mean, there's a whole lot that can be done within communities by way of prevention. Let's talk solutions again. What can be done at that level?
I think the first thing is a community understanding, and I think this is the bottom line is what Dr. Moeti was saying. If we do not have healthy population, we certainly are not going to achieve any developmental goals or anything in terms of a developmental aspiration or agenda. And so in terms of communities need to understand that they and they alone are the custodians of their own health, and they need to be active participants and active citizens in the conversation with regards to their own health. So for a long time, they have been very much passive recipients of what we give them in terms of the health system. And so for me, it's about, on the grassroots level, a community should be able to say, we expected this clinic, for instance, to open at 8 o'clock, it's only opened at 10 o'clock, and it's closed at 12 o'clock. So when we talk about access, it's a very broad concept, other than just having an institution or a clinic or a hospital standing there. It's what is happening in there. Is it opening? So if we have a clinic built, but nobody opens that clinic, or it doesn't meet the working hours of the population, it becomes a problem. So for me, in terms of that grassroots level, it's about, yes, the health issues around health education, but certainly communities need to know that they can actively participate, and we need to create those platforms for communities to actively participate. And I think we've done well in terms of clinic committees and hospital committees to hear that voice of the community.
And we have organizations like Section 27.
Absolutely, absolutely.
Right. So after the break, we'll now take a look at the road ahead. Please stay with us.
SABC News, we report, contextualize and present news and current affairs honestly, fairly and fully. We consider it a duty to provide consistent, relevant, useful and top quality information and analysis. Our mission is to provide credible, accurate and interesting news programming, bringing news into everyone's homes in everyone's languages. Thank you, South Africa, for relying on SABC News for quality news output and for making us your #1 source of information. SABC News, Africa's news leader.
Welcome back. So what's the road ahead looking like? How solid is the strategic plan to address these current healthcare challenges? Well, let's find out from our guests. And this time around, I want us to start in Cape Town and speak to Sasha. Sasha, just now we're talking about the importance of community activism. And I'd like to get your comment on that, please.
I couldn't agree with that more. I think we've seen from activist groups like the Treatment Action Campaign how important it is for people to stand up for their own rights and to make demands on their healthcare systems. And we see that kind of activism in a lot of places. There are pockets of activism across the country. But what the National Health Insurance Program is going to rely on is people speaking up, people making complaints to the Office of Health Standards Compliance where necessary. People, as the previous speaker said, saying, it's not good enough that my clinic doesn't open on time. It's not good enough that there are no drugs here, or that there are not the drugs that I need for my ailments. And so this issue of people standing up for themselves and standing up for their health rights is vital to the operation of any health system, and particularly in South Africa.
Oh, great stuff. Now let's come back and look at, perhaps, back home we have the National Development Plan, that has a long-term view up to 2030. Well, there's a few things, outlined there to try and, I guess, improve, things in general. But obviously, we're talking about health. In terms of how we've set ourselves to achieve these things. I mean, one of them being eradicate HIV, eradicate TB. What's your view in terms of, what we have in place now going forward to 2030?
I think, as I said earlier on, one of the things that we do so well, and I think that which are very good in our country, is our policies and our plans. And so the National Development Plan is a very good piece of work, I think. And but over and above that, we do. I always say, without a healthy population, you can't achieve any developmental anything, whether it's an agenda, whether it's a goal, or any developmental aspirations. So as such, and what I do like about the National Development Plan is that it doesn't only look at health issues, because we don't want to leave this program and think that health issues are only vested in the Department of Health. There are broader departments that actually come into play. Right. For instance, if you look at issues around violence and injury, the policing department has to come into play. If we look at the infrastructure, issues around road, we now have just finished the issues around the Climate Health Summit, or COP21. Issues around climate change will affect agriculture. Agriculture will affect whether people get the correct food, get the correct nutrition. So as such, the one thing that's very good about the National Development Program is that it's very much pronged, and it also looks at multidimensional, and it also looks at a lot of different departments which are going to aspire to get the developmental agenda in place.
Okay. Dr. Boyd, we obviously set ourselves, according to the MDGs, to try and do our best, to tackle some of the issues, especially maternal mortality and child mortality and so on. And obviously we missed the target somewhat because of obvious reasons. Now, going forward, what's your view in terms of how we're looking? Can we get to a point where we bring all of these things under control within the 15-year time frame?
Thank you. Yes, I think what we have to do within this 15-year time frame, I think we've got a lot of good instruments to guide how we get there.
Right.
We've got the National Development Plan, which I think is multi-sectoral, looks at health as a developmental issue, and the connectedness with other sectors comes in. We've got the Sustainable Development Agenda, which I think has a lot of convergence with our National Development Plan 2030, so that in the end, what helps us, I think it's a good way of also making sure that our national strategy is in line with some of the global issues. We're taking that information and strengthening that. And I think if you look at the progress we've made over the time of the Millennium Development Goals, I think there has been progress around HIV/AIDS. Maternal mortality is declining, but yes, we failed to meet the target. We know that infant and child mortality is declining, but there's still a way to go. But I think the important thing is that we have strategies to guide us, targets and milestones to meet, and then ways in which we are going to try and measure that progress. And I think the important thing for me, or the opportunity in this next developmental period, is really we are looking at the interrelatedness between sectors and their inputs. And I think what the public health practitioners and others and the country needs to do is we need to recognize that many different sectors have inputs to make in terms of health, which is one of the best investments any country can make. But often what happens is that we then tend to hold one sector accountable. We will then say, health, you need to deliver on A, B, C, D, E. But we forget that for a mother to be able to reach a clinic in time, roads need to be in place, electricity supply needs to be reliable, and so on and so forth. So I think the metrics that we need to develop for this next period are to really make sure that accountability in terms of delivering on this agenda, that these other sectors play our role, and that we as the health sector also give them space to then give input into what we are going to do moving forward. So I'm very hopeful rather.
Right. But are the targets and the milestones reasonable? I mean, are we... it's one thing to set yourself some targets, but if you set yourself, difficult targets and then you don't reach them, you end up with egg on our face. What do you think in terms of the targets that we've set ourselves?
Absolutely, I think they can be achieved, because one of the things that many of the current strategies, what has informed them is actually evidence, unlike the previous strategies. So these strategies have been very much informed by the research and development and the evidence that has been provided by various organizations. For instance, in our country, we've got fantastic organizations like Dr. Moiti's Health Systems Trust, the Medical Research Council, and of course we can't forget the Section 21 colleagues who provide very valuable inputs into the research and development. So those targets are numbers which are informed by evidence. So I definitely think that we can achieve them. We just need to sit down and not work in silos and work alone, but to have a multi-pronged, multi-sectorial approach in terms of solutions.
Well, very interesting. So the road ahead really looks very promising. Obviously, there will be bumps there and there, but it looks quite clear, at least for now. Well, folks, I'd like to thank you so much for your contribution today, Dr. Flavia Senkubuge, Public Health Specialist and Vice President of the African Federation of Public Health Association, Dr. Themba Moeti, CEO of Health Systems Trust, and in our Cape Town studio, Sasha Stevenson, attorney from Section 27. Thank you very much for your contribution. Okay, folks, well, it's on that note that we come to the end of our show today. Join us next week on SABC News. A reminder to please share your views and comments via our Facebook page, SABC Health Talk, and follow us on Twitter at SABC Health Talk. Remember that you can watch the repeat of this show at 2 p.m. today and Tuesday at 5 a.m. Or simply go to the SABC YouTube link to get all our previous shows. I'm Dr. Sello Mukdaung. Thank you so much for watching Health Talk, and please do take care. Happy holidays.